So what I've prepared today, I wanted to talk about conducting the agency internal audits. Back in May, at our meeting, I spoke to you all about how the emergency for COVID-19 had been ended. And so that meant that you all needed to go back and start doing all of your audits. Those were put on hold by DHSR because they knew you had so much to do. Now those things need to be done. You need to start doing those on a regular basis. So I got a few calls after that for some people that really didn't know how that worked. So I want to just show you all a few things today. I'm not going to be able to go into full detail. There's a lot on some of my slides. I'm going to just hit highlights for you. And if you need something, you can get in touch with me later. So, of course, anything that you all do in the agency, you need to document what you do. So if you do an audit, either the 90-day or the annual audit, you need to keep a record of the names of the persons that are conducting the audit, and of course, their titles. I always did it with my administrative person. It's good to have a clinical person on the audit staff when you're doing those audits. So a nurse and maybe an administrator is good. Your agency director is good if you can be there, but I always did it with 2 people because I ran very lean. But if you can run it with 3 people, that's probably the maximum, because you don't want to get too many people involved because it's hard to coordinate everyone's schedule. I think 3 would be a good number for most of the agencies that are the size that we deal with. And then you need to know what is the criteria and the method you use for that particular audit. So the method that I considered was, I've told you all in the past that you need to have a list of all of your clients, a current list that's always available. Because if you are subjected to a survey, when that surveyor comes to the door, the first thing they're going to ask you for is, I would like to see your client list. And I mentioned to you all to keep a pared down list that just has the names and maybe the date of birth that you can hand to the surveyor. So if you wanted to use that particular list or any other list to choose the clients that you were going to audit for that period, you may want to do the first and the third or every 4th one, however you want to do that. But just put down how you chose those individuals when you did that audit. And then at the end of each audit, whichever kind you're doing, if it's the 90-day or the annual audit, you want to do a summary of the findings. If you came up with things that you know you needed to do better, you want to put those recommendations down. And then if you took some action, I don't know if you would take some action while you're doing the audit. If not, if you later on you took action, based on those recommendations, you would go back and notate that later. So I'm going to talk about the quarterly audit first. At the end of each quarter, in your policies and procedures, you have indicated that you will do a client record review. So that's what I'm going to talk to you about right now, is a quarterly audit. And so since we are now in the, we're really getting ready to go into the 3rd quarter, you should have done 2 of these, the end of March and the end of June. So if you missed the one in March, you might be okay, since the emergency COVID-19 restrictions were lifted in May, but you certainly should have done one at the end of June, or you should be doing one right now. Most of your policies and procedures say that you will do a 10% sampling of your records. So if you have 100 clients, you would do at least 10. So just a 10%. I personally never did less than 5. So if you had 30 clients, it would mean you would only have to do 3. But I always thought 5 was a good number because you can start to see trends there. You should look at active records. And some of you do nursing pool or have contracts. You should look at any of those that are under contract. And include all of your services. If you have companion sitter, if you have in-home aid, look at all of those. And then be sure you look at your closed records, your discharges and your transfers. discharge, you discharge them from your agency. Any of these are discharged, even if it's a transfer to another agency, it's still a discharge. So you try to include at least one or two of those as well. So in the 90-day audit, there's a lot on this, but I'm just going to hit some highlights. You look at performance improvement. Mainly, are you doing your 90-day audits? Do you have a complaint management system? I don't think I've talked to you all a lot about that in the past, but every agency should have a complaint log. And there are certain things that happen that you need to put those on the complaint log, take it through the process, whatever that process is going to be that you would like to do, whatever the process is. And then if it gets resolved, you go back to that log and say that it was resolved and put down the resolution. So if you don't have a complaint log, please create one. I did not put every single little thing on the complaint log, like someone was late for work. Anytime you get a complaint, you need to fully vet that complaint and just be sure that it's valid and that it needs to appear on that log. The thing that you don't want to do is have your client call DHSR and they come in to do to look into the complaint, to do an investigation, and that is the complaint is not on your complaint log. Now, of course, if it really wasn't a valid complaint or if the client is just disgruntled, they might recognize that. But if it's valid, I think it should be on that complaint log, annotated and closed out as to whatever the resolution was. And then they look at the personnel files. Are they current? You know what your personnel files need to have in them. When you got your license, you show DHSR certain things about how you were hiring people, what you were doing, how you vetted them. They want to, when they look at your records, when they give you your license, they are assuming that from there, you will always follow that procedure because they approved it. So they're assuming that your records are going to look like what they approved. So just make sure you follow that. As far as the plan of care, you want to be sure that they want to see that a healthcare practitioner actually looked at that service. And that's what you want to do. You want to be sure that if you got a referral, that you sent someone out there to look at that client and that your nurse, your RN, pretty much in most of our services created a plan of care. Now, if it's a companion sitter client, it can be a service supervisor, but just remember that. And also the ADLs, make sure they're assigned properly. We talk a lot about that, about properly assigning a client. And then your service notes. We know that everything that you do needs to be documented. You know, are the times and dates on the plan of care. Most of you, or probably all of you, are doing some form of electronic visit verification. So that's going to mark the times and the dates. And then the tasks they would also check off. And if there are deviations, say that the client didn't need services on Tuesday, June 30 or whatever, then it needs to be documented why the services were not rendered. And then under service management, this looks at whether your RNs or your service supervisors are actually going out, doing the visits on time, doing the supervision, that if a client wanted to be discharged, did they actually give them the 48-hour notice? You all remember that if you discharge someone from your end, you need to give them a 48-hour notice. However, if they decide that they do not want your services anymore, they can go ahead, you can discharge them immediately. Other things to look at, the finances and the billing. Now, sometimes when we look at this, we're thinking you billed Medicaid, did it match? That is true. However, some of you deal with long-term care insurance companies. You want to be sure that all of that billing is accurate, that you're only billing for the services that you provided. And then your customer service, just look at things like, are your clients staying with you? Are they leaving for a particular reason? Have you had an increase in clients? That's kind of an indication that your agency is doing a good job. And then be sure that you file with DHSR when they say it's time for your license to be renewed. Are you doing that? And then are your audits, if they come to survey you, is your audit, is it done well? Or did they find any corrections? Did you go back to them and Make sure that you told them you corrected whatever they asked you to correct. And then they talk about, is the overall yearly evaluation completed? I'm going to talk about that next. And I talked about the summary of the findings and the actions taken. Make sure you have something like that where you can totally review what you did and make sure that it's legible. Sometimes the surveyor may go directly to the summary notes. They may not look at all the other stuff you did. They will look at what were your findings, what did you do, and then they may backtrack from that. So make sure that that particular area is filled out. Now, the annual program evaluation, you should do this at the end of each year. If you did not do one last year, make sure at the end of the year that you do one this year. This is really a summation of the things you've been doing all year long. It just goes back and kind of puts it all together. It may be possible if you do a good enough job on your 90-day client reviews, most of that information can be combined, especially if you're keeping up with going ahead and resolving any issues. Okay, there's how do you implement your policy? Just keep in mind that the policy that you have to run your agency should be followed. Many agencies have received citations because they didn't follow their own policy. So every now and then, go and look in your policy and be sure that you're following all of the things that are in there. If you identify problems and solutions with services, emergency care, personnel records, or supervision, all of those things will be covered in that annual program review. So this is one that I've used over the years, and I'm just going to show you some things on there. There's an administrative review. Is your organizational chart still valid? Most of you, all of you, when you got your license, you showed them an organization chart, which pretty much said the agency director is at the top. And then that could be the same person as the RN. Then you have your companion sitters and your in-home aides separated out because you could have a separate manager for them. The in-home aides need an RN manager, but the companion sitters can have a service supervisor. But the RN can supervise both. A service supervisor cannot supervise the in-home aides that do hands-on care. So just make sure your org chart is in place, that you have an agency director, that you have an RN, and that every now and then that governing body is looking at the way things are being conducted in the agency. If your agency director does not sit down for the audit, you want to be sure that they review it later, just in case. And then I just talked about policies. Make sure you go in and review those policies. I know every now and then when I would go in and review mine, sometimes I would be just kind of shocked. I'd be like, oh my, we need to be doing that, or I hadn't looked at that in a while. So try to look at it maybe twice a year might be good, because there have not been any changes to the policies since 2018. Hopefully all of you have a current policy after 2018. However, some of you, your agencies have been around a long time. Maybe you didn't get it updated, but that's important. As far as the personnel, that there is a supervisor that is on call during all of the hours that you have services provided in the home. We've covered that many times. So if you have clients that you're doing 24-hour care with, there needs to be a supervisor. And if it's a hands-on client, and it probably is if it's 24-hour, there needs to be an RN on call for all of those hours. And then for the qualifications, everyone should have a personnel file, of course, and they should have a written job description. When you all got your license, you submitted a written job description for every position. Make sure it's there. Now, if you have an RN that functions as an agency director and an RN supervisor, she needs to sign both. She needs both of those job descriptions, because under each of those duties, she's performing different tasks. As far as the supervision, there's 2 levels of supervision for the aides. The companion sitters don't have to be supervised as often as your in-home aides, but someone needs to make contact with them, go to your policy and see what that is. Make sure you're maintaining your records for the required time. As far as my memory serves me, you should keep those records at least 5 years after that client is discharged. If anybody has different information, let me know, but you should keep it at least 5 years. And then are you arranging for services with other agencies? Say you have a nursing pool license and you're issuing contracts, or you're contracting with someone else, you need to review those as well. And then on an ongoing basis, this is the yearly evaluation that I'm looking at, but you want to be sure you look at your budget and your billing and accounting at least once a month. That's just a good practice. You don't want to wait this late to look at it. Things are just too easy to get out of hand. And then your scope of services. If you are a companion sitter agency, make sure you're not doing clients that need hands-on care, because you're not licensed to do that. Your operating hours, your geographic area. If you got your license and you said you were going to cover 5 counties, don't go outside that before you go and get approval from DHSR to let them know that you have expanded your services. I believe that may be one of the things they allowed your agencies to do during the emergency for COVID, but you should not be doing that now. You need to go and let them know that you want to expand your services or get another office, whatever that is you want to do. They need to be notified. Your admission and discharge policies need to be followed. Now you're looking at that on a 90-day basis. Everyone that was discharged, you're looking at whether they got the 48-hour notice. So this is just a summary of all those things you did all year. Your plan of care, is it written? Just make sure that you looked at the emergency care guidelines and that your plan of care has been signed by your RN and also the client. If there's care that's needed, say you if a client goes to a nursing facility or whatever, how did you coordinate that? Did you make sure you knew where they went, that their services picked up on time, that your aide didn't stop working there before they were actually gone? And then look at your service records. I know many of you are doing electronic records now, but just make sure that everything is being documented. And then at the end of the year, you want to do a summary of your discharges. What was the reason they were discharged? You want to always put that on your discharge summary. In your client admission package, you should have a discharge summary page. And just as a side note, discharge begins on admission. The nurse should always make a note when you admit that client that says, you know, Mrs. Jones we're going to be providing ADL care for her, and we will review her status every 90 days. And the way you do that is on your supervisory visit. So because you may go there on one of those 90-day visits and she no longer needs care, especially if you're dealing with Medicaid. They also oversee whether someone still needs care or not, but make a discharge note upon admission. That's just a good idea. And then later on, further down the page, you can add when they actually are discharged from your facility and why. Even if that person passes away, you need to go back into their chart and make a note that that client expired, however you want to use that, and put the date. It just lets, you know, the surveyors know that you're on top of things. And then there are clients that you're going to get that you will not admit. You've brought them in on your log, you looked at them, maybe they were out of your area, they were out of your scope. And so you want to quickly look at the clients that you have coming in to be sure that they are clients that you can take. I know some agencies have a habit of holding clients on their list and not servicing them. But if you cannot service that client for any reason, your staffing cannot be met by the agency. I know that's a huge one for you all now, but go ahead and make that determination so that agency, that client can move on to another agency. And again, that's why I want you all to communicate with each other so that maybe you have another agency that you can refer them to. I always had some other agencies in different areas that I could call, and they did the same for me, because in the end, we are really interested in making sure that all the home care clients are taken care of. So that's basically what I had today to cover with you all on the audits. as far as me giving you this information. I love talking to you all about it every month and trying to keep you up to date. But before you make any changes in your policies or any of the things you're doing, make sure that your governing body approves that and knows that you are going to do that before you make any changes based on what I have offered here. So I'm going to open the floor up for questions. If you all have any, you can just open your mic and ask a question if you have any.
Hey, Patty, I had one. Could you clarify a little more about what you meant when you said start your discharge summary when you admit the patient or the?
Yes, a nurse knows how to do that, Frank. Whenever you bring a client on to a service, you just make a note that says, this is what we're doing for this client, and we will monitor their status. And that just says that later on, if they need to be discharged, you will. But just make a note that you thought about that this client may eventually be discharged. They may not need this service forever. So discharge planning is what that's called. It started on admission. Those nurses on the line know that. That's a good thing to do in home care as well, not just a hospital or a facility. So just make a note that you thought about the discharge planning. All right. Well, thank you all for coming today. I will make sure that I get this up on our YouTube channel. If you all have any questions for me, you know how to get in touch with me because you have my email, and just give me a call or drop an email and we can discuss things further. You all take care, and we will meet again next month. Take care.